All right. Heyo. I'm Dr. Nader Amer with DNA Physical Therapy, and this is YouTube Live. Today we're talking about the diving into health, optimizing your swimming and performance, and injury prevention. All right. Um, so what we first will be talking about is an introduction. Oops, that's the wrong screen. That's the right one. There we go. That's me. Okay, so welcome. My name is Dr. Nader Amer with DPT, Doctorate Physical Therapy. I have 10 years of experience as physical therapy, working in a variety of settings from acute care hospital to rehab hospital to outpatient setting to home health. Now I have this wonderful practice, DNA Physical Therapy, and I am starting to build it from the ground up, so please support me. I'm a lifelong athlete, swimmer by trade, I would say, since I was in high school, swam D1 college for the College of William and Mary, picked up some basketball, football, soccer, ultimate frisbee, and weightlifting on the way. I'm passionate about rehab, and I love working with clients to rehabilitate themselves, get back to their goals, to their sports, to their athletics, whatever they need. Brief overview of DNA Physical Therapy. We provide PT services and strength and conditioning services. Physical therapy, we do in-person or virtual sessions. You can provide it in the clinic, home, office, or gym. Strength and conditioning, we do one-on-one training for if you want to, are you getting into weightlifting or strength training and you want to make sure your techniques are good, make sure you're safe and you're doing the same thing. Provide workout templates if it's either getting to a goal in your sport or aesthetics where you want to lose weight, get some tone. Next, we do have injury toolkits that you can provide at dnaphysicaltherapy.com/toolkits, and that will be working for you as well. All right, let's go next. The agenda. What's today's objective? It's to not stress me out, but it has because of the technical issues, but also educate you. So we're here to educate on common injuries that swimmers get and how to prevent those injuries. What I want you to walk away from this presentation is the importance of physical therapy and common injuries in swimmers: shoulder pain, swimmer's shoulder, neck pain, and low back pain. And the role of physical therapy in injury management and prevention and treatment strategies. And at the end, we'll have some Reddit questions from the swimming Reddit forum, and I'll open it to questions to you guys in the audience. And don't forget to reserve an appointment at dnaphysicaltherapy.com and like and subscribe to all of us at YouTube, Instagram, and Facebook. All right, about DNA Physical Therapy. Core values. Core value is personalized custom care. That's what I want to provide. That's what I want to give you guys. I want to focus on that you guys are the center of attention. I know you guys have been to physical therapy before where you were in basically a mill where you were going in and out, no one even talking to you, your therapist not touching you, not getting to know you and give you the care that you need. So when you use DNA Physical Therapy, you get me or one of my colleagues to do one-on-one treatment focused on your goals and your needs. So also with DNA Physical Therapy, we come to you in your home, office, or gym to allow us to have you ease access to care to you for the things that you need. We all know that life gets in the way between work, family, kids, stress, all that jazz. So that's why we're at DNA Physical Therapy. We're trying to make it easy for you to get the things that you need. So the services that we offer: injury assessments. If you tweaked yourself playing pickleball or not tore your calf, but strained your calf this week, then you know that you need some physical therapy services. You don't need a doctor's note or prescription to come to physical therapy anymore. You have a direct access. So let's go back to this screen because I'm feeling fancy switching it all up for you. The rehabilitation is a common thing for physical therapy. So after you injure yourself, you go to the doctor, you had surgery, you come to PT. We provide that for all simple orthopedic issues. But my favorite is performance enhancement and specializing with team. So those are the services that we provide at DNA Physical Therapy. All right, next. The importance of specialized physical therapy. So, custom approach. That's the benefit that you get with DNA physical therapy. You get that personalized treatment care, individual health assessments. Therapist comes in, we ask you all the questions, you give us all the information. The more data you explain to us, the easier it becomes. We provide you with a custom exercise rehab routine, monitoring for specific needs, give you a flexible plan to go with whatever you want. I always ask my clients, how much time do you want to spend on doing this and recovering and rehabbing? And obviously, I try to make sure that you guys are understanding where it's coming from. Adaptable methodologies. So if we're not peaking at the right time, we can adjust as it is. When you have that custom personalized plan, that's something that's better for you. And then we set those personalized milestones, short-term, long-term milestones, basically setting those goals. One-on-one sessions, you get individual attention, tailored guidance. If you're performing an exercise or a corrective technique wrong, I'm there for you to get you going. You get immediate feedback from me. I'm not going to keep my mouth shut. Do not worry. Benefits of that for athletes, for specialized physical therapy. Faster recovery. Target that specific muscle group, that joint pain, whatever it is, we're going to help you get there. Accelerated healing time means that you're getting those techniques. It doesn't matter if it's with therapists or on your own. I'm going to give you the tools that you need to improve. And it minimizes downtime off the field. I know most athletes want to get back to their sport as quickly as possible. I've been working with a lot of triathletes lately, and I can't get them to catch a break. So minimize your downtime. I know you need it, but recovery is important. Performance optimization. I got an athlete background. I've done most sports, so sport-specific training is important. Enhancing your mobility and strength and improving your overall endurance. Any athlete can relate to that. Also, long-term gains, building that base so you have that sustained wellness just from now until we're aging when we're 90 and 100 years old. And all the exercises you learn from physical therapy doesn't mean when you're healed, you're done with it. It's an injury prevention. All those exercises, those programs, YouTube channels that are out there, they're very helpful for you to improve and maintain injury-free. Let's get into the juice. Common injuries in swimmers. Rotator cuff is the most common issues. Symptoms are obviously shoulder pain, weakness in your shoulder, reduced range of motion. So it doesn't matter if you are just only doing one event. You could be doing butterfly, you can do freestyle, you can do backstroke or breaststroke. All those things cause issues in the shoulder. So what you want to focus on is proper dynamic warm-up, which I've given you a list of exercises here of easy, simple, dynamic exercises and stretches. Scaption 12s is my new favorite exercise I posted to my YouTube channel, and the shoulder blade blade runner. These are two great exercises for dynamic warm-up and static stretching for you to do before you get into your events, you get into your workout, you get into your practice. And then next thing is consistent shoulder, neck stabilizing exercises. This can be done simple body work or isometric exercises. So you got the I's, Y's, and T's there that I have listed for you. So you got the I's, the Y's, and the T's. Simple exercises, easy warm-up, stabilizing the shoulder blade, stabilizing the rotator cuff. It's an easy exercise for you to perform. And then shoulder taps. I can't perform that on my bougie new setup here, but you can click. I'm going to provide this presentation in the description on YouTube. So feel free to click through these websites, and they're all on YouTube. So like and subscribe to my channel. Heyo. Next, what do we got? Back to this camera. Swimmer's shoulder. So swimmer's shoulder is common in swimmers. It's commonly said that it's an overuse injury, but I'm going to say it is more of a stroke mechanics breakdown. So muscle imbalances between strength in the anterior part of your shoulder and the posterior part of your shoulder. So anterior is the front, posterior is the back. Medially, inside versus laterally. You've got so many dynamics, different chains going on in your body that if one side is stronger than the other, then you're going to cause those muscle imbalances, causing that shoulder blade to rotate forward and cause that shoulder pain in the front of your shoulder. The importance for this to treat it is mobility and flexibility. Most swimmers are hypermobile, meaning that they're way too flexible. So I created this YouTube video called Swimmer's Posture, Shoulder Pain. It's a toolkit for you to improve. Simple exercises, simple stretches for you to do to perform. Next, stroke mechanics. Overuse is, like I said earlier, is the most common thing they say with swimmers' shoulder. I would say it's actual breakdown in your stroke mechanics and a breakdown in your stroke technique. So best treatments for swimmer's shoulder is strength training. Can't go wrong getting strong. That's a joke that I stole from some guy on the internet. But the focus for this is drill work in the pool. The best thing for you is kicking on your side with your arm extended. So let's switch screens here, and I'm going to show you my bougie-ness with that. So kicking on your side, arm extended over your side. Focus on keeping your palm in the right position. I don't want it flaring out, forward or back. Try to keep it in a neutral position. Head by your side, kicking nice and easy, turning that head to breathe and come back down. This is a good exercise to warm up before a race, before practice. I know as a master swimmer, we don't drill that much, but it is important to get that, squeeze that in the beginning of practice or after practice when everything is over. Next, you got the skull drill. So we all know the skull drill is just sweeping those hands either out to the side or figure eight situation. That's going to help realize that shoulder position in place. We got to make sure that you can feel that proprioception, where your hand is in place. So when we're pulling in that certain position, that you're able to pull without pinching your shoulder or putting extra strain on those areas, which cause the overuse injury that most doctors and clinicians diagnose. So then we got the hand and elbow placement during the pull phases of all strokes. So I'm sure we've all had coaches that talk to us about crossing midline, and that causes the pinch in the shoulder and things like that. But it's not just in freestyle. These are all strokes, breaststroke, backstroke, butterfly. All those things cause shoulder pain, and specifically swimmer's shoulder. And sometimes frozen shoulder. So let's go to the next one. Next slide. Back strains. So everyone's got back issues, it seems like. Doesn't matter if it's caused by swimming or it's caused by stress or caused by lifting your dog Halpert off of the ground. So next, we got typical signs for muscle pains, muscle spasm, muscle cramping, pinching. Those are all common things that we're suffering from, but it's important that you understand that it's not just from swimming alone in itself. You got those short axis strokes like breaststroke, butterfly that cause issues and extra strain in your lumbar spine in this area right here. Also, flip turns cause increased impingement in your SI joint, causing other issues. So as you can see, I have the deep muscles and the superficial muscles listed here. They're all affected and intertwined, especially in swimmers. Limited flexibility and muscle imbalances cause those back pain and those back issues. So next, how do we improve all those back pain, neck issues? Injury prevention, strength training, and stretches. So the first thing we have are bridges. So bridges are a great exercise to perform to improve your glute strength and your core. Simple exercise, you can start with the video that is provided in this presentation, but also there are a different variety that physical therapists and other personal trainers as well that can do to challenge all these situations. And then side-lying hip abduction exercise. Everyone's saying, oh, why am I doing hip exercises because my back hurts? Well, when we have weak glute medius right here, that causes extra strain right here in our low back because our hips sway too much back and forth because we got weak hips. So strengthen those hips and those glutes so that we help decrease your low back pain. Stretches, prone press-ups. I like to prescribe this exercise to swimmers because we're always flexed forward. We're in the forward position. Why would I want to do that? I'm always in this position. I'm always swimming like this. I'm tucked in this position. So a prone press-up is basically reversing and giving everything in full extension. So that's very important for you to understand how important not only is strength training, but also stretching is for you to provide all these awesome techniques. Next, child's pose with a trunk twist. Can't perform this one because it's on the ground and I don't have the setup for that. But click on that link. It helps improve your, everyone knows what child pose is. It's a good stretch to open up the back, but with a trunk twist, that helps open up the each side, especially with swimmers, since we're all rotating side to side. It's important for us to know that you're able to sync everything up, and that helps with the imbalances that we were talking about earlier to help with all types of pain. Next, let's go to the neck. Neck pain. Common problem with neck pain for swimmers is poor posture. This is my most common posture. See that? That's beautiful right there. Look at that. Look at that humpback. That's great. But you can't do that. That's not good. It's bad for your neck, bad for your back. So common triggers for neck pain are tight pecs, major and minor, weak rhomboids and traps in the back. There's a common misconception that we have tight necks, but to be honest, sometimes that tightness that we're feeling is actually weakness. That muscle itself is straining so hard to keep that neck stable that it causes that neck pain. So we're constantly stretching it. And when you stretch that tendon or that muscle and it's weak, it causes more pain because you're stretching it out and you're not giving that support. It's relying on that tightness to keep that neck stable. So you need a physical therapist, this guy, to help you diagnose that. Some management strategies for neck pain are the anterior pec stretch. It's a great exercise, easy to do. Click on the link. We'll do that. Make it a field goal position, just like when the Eagles won yesterday. And then you lean forward and you stretch out, open up the anterior part of your chest and shoulder. Wall angels, everyone I prescribe this to hates it, so I will show you how to do it. So we come up, it doesn't matter if it's a wall, board, floor, come up against the wall, squeeze those shoulder blades in the back, hands against the wall, come up like you're making a snow angel, up and down, up and down. It's great. It's great for your shoulder mobility, scapular mobility in the back. It improves also your posture while you're sitting at your desk, where you're sitting in your car, slouching, watching TV on the couch like I usually do, or if you're in your bed playing on your phone. So I didn't put my infamous chin tucks video on here, but don't forget to check it out on my YouTube channel. So let's talk about prevention and treatment options. General tips: provide yourself with recovery days. That is a common thing that I'm realizing with my high-level clients and athletes that keep pushing themselves, playing pickleball 3 times a week, training 50 miles of running, and then going and swim 2 hours every day. Those are all things that cause your body to break down. We can't always think about those things and think about push yourself, because the next competitor is doing that. Also, you need your body to recover to handle all the stress and strain that you put on your body. What is the focus on most drills is head position and trunk rotation. Most people make fun of me for having my PVC pipe for trunk rotation, but let me demonstrate how cool it is to do this task. Let me get the iPhone view. There we go. So we grab the PVC pipe, put it on the back of your neck right here. All you do is just sit here and rotate back and forth. It's a simple exercise, but I already got a bunch of pops in my low back and my mid back. That's very helpful. My sister's over here making fun of me right now, but it's great. It's a surprise, but it's a simple task that you can provide with a PVC pipe that can relieve some pain in your neck and your shoulders. What is the role of a physical therapist in this? Expertise going on. We can provide custom regimens like for strength, stability, and mobility. So reach out to, I'm not saying come out to me. I would love to have you, but I'm the best. Next, let's go. Physical therapy's role in injury management. So what do we do as physical therapists to help you with early intervention? Well, the role is to improve your recovery time, decrease risk for further injury, And you don't need a doctor to give you orders to come to physical therapy. What you really need is someone to take a look at you and give you that confidence to say, hey, you're not going to injure this more, or B, hey, you really need serious consideration, you need more imaging, you need a consultation with a surgeon or a podiatrist or someone special. It could be an orthopedic related issue, but it could be a systemic issue of underlining systemic issues like multiple myeloma, some sort of blood disorder, things like that. This guy has experience with that. And here are some 2 resources to show you the importance of physical therapy and injury management. These are 2 Journal of Orthopedic and Sports Physical Therapy Journal articles saying for triathletes and the importance of physical therapists and musculoskeletal injuries and the relationship of shoulder flexibility and strength in competitive swimmers. So these both articles show that physical therapy is important for injury prevention and return to sport quickly. Next, continued about how important my job is for you. So rehabilitation, I'm a fan of nerding out and reading articles about how important and how to make my job easier for you, the clients, or for me to provide you the best care. And here are some research articles for you. The importance of consistent treatment. So consistency is key. If you don't see a physical therapist, or if you do see a physical therapist and you can't see them as much as often as you would like, the key is to consistently participate in those programs or exercise programs or stretches that those therapists provide for you so that you can get back to what you need to do. Consistency is key. What are the range of treatments that physical therapists offer? Exercises, stretches, modalities such as ultrasound, light therapy, electrical stimulation, or most patients and clients like manual treatment. The therapist getting their hands on them and feeling and touching and making sure that they are moving in the right way so that they can perform in the most optimal way possible. All right. Performance enhancement, techniques for better performance, custom approach is what's provided by physical therapists. They listen to what your needs. They gather all the data that you need to give you a personalized program so you can perform better and recover faster. An example of physical therapists is in this research article on lower extremity injuries in preparation for return to sport, mostly basketball players and football players with ACLs returning in that article. And then monitoring your progress, setting those goals, short-term and long-term, having those milestones, and self-reporting back. That's why it's important to have the same therapist come to you each time so that they know how you're improving, how it's different from when you began, and how it's different from when you're starting. I guess I should probably take a little break here and see what's going on with the chats. Any questions going on over here? Can't wait for the live stream. Well, it's here, buddy. Yeah, I make house calls, so it's great. And if you don't have access to a gym, DNA Physical Therapy has a gym for you. So feel free to reach out for that to provide those consultations. If you have any questions, feel free to put them in the comments, the live chat, and I'll take a look at them for you. Thank you again for being patient with our technical difficulties at the beginning, but I think it's working out. Let's continue. All right, next topic. Prevention and treatment strategies. So here I have a list of articles and warm-up exercises that will help with shoulder pain issues and with preparing you to get ready for your big milestones like cycling, running, pickleball, breath work, any of those things. So the importance of stretching and flexibility in exercise is compared to none. In this article, it shows the benefits of sports performance and injury prevention with stretching. I know there's a lot of talk out there how stretching causes more injuries than not, but that's from pretty poor methodology research articles, I would say. And I think a lot of research is coming back telling the opposite of that. So here are my recommendations. I have 3 warm-up exercises for you to perform to get you ready for all different types of dynamic exercises like pickleball, swimmers, cyclists, and runners, and then 6 dynamic movements for breath work. Strength training. What's important about strength training for you is the static and dynamic. You start with that core strengthening at a static, especially when you're injured. Everything is more static. Then as we progress and become more active and we get more confidence, then we start adding more dynamic stuff. And that's what we really want, is to get into the nitty gritty of everything and that dynamic and challenge those muscle balances between the anterior chain, the front, posterior chain in the back, and then the lateral chain on the sides. Posture correction, importance for injury prevention. Not having that hump back that I have, and the constant techniques that I do with the wall angels and chin tucks in the strength training program that is helpful for injury prevention. I mean, I've had many competitions that I focus on and train for. It's very helpful for strength training that I've done on my own is very helpful to improve and maintain my goals into reaching Masters Nationals, doing a 10-mile open water swim in La Jolla in a couple weeks. So these are all things that are helping me to maintain my life goals. Let's check for some questions. Okay, we got a question here. There's an easy way to strength train throughout my day without having access to the gym. Of course you do. You got body weight exercises that you can do. You have simple techniques and exercises that I have plenty on my YouTube channel. So feel free to reach out to me through YouTube, social media, or schedule a virtual session where I have a free 15-minute consult that we do on Zoom that you're able to perform and do work with me and have a discussion to help guide you in the right resources, or to schedule an appointment with DNA Physical Therapy. All right. Let's save the questions for a little bit later because I got a little bit more on my spiel to get to. So let's get going. Range of treatments offered: exercises, stretches, and manual treatment. I'm sure if you're on this video, you experienced physical therapy before, you've talked to me about it before. And these are all valuable things that are the essential building blocks for physical therapy. Modalities, when and how to use them. Again, this is another physical therapy treatment that has been getting a lot of heat lately for the efficacy of it. But I put a nice little systematic review, meta-analysis on how important it is to actually have these treatments, especially with heat and ice. So take a look at that and we'll get going forward from there. I don't know what I did. Abort. There we go. And we're back. Next, we are questions. Perfect. So let's go to the live chat and let's look at the questions. After an injury in PT, how do you mentally prepare to get back out there without losing confidence? So it's a great question. Confidence in physical therapy, I think, when clients come to me, they're at their lowest with confidence. And so throughout my treatment sessions, if it's one session to multiple weeks, what I try to encourage is challenge yourself. You're challenging yourself each day to see if it's a shoulder injury, if I can take my shirt off with both hands or one hand. Those are small challenges that you gain and get for yourself. But ultimately, like one of my clients today, she was doubting herself to see if she was able to go play pickleball next Friday after she strained her calf this week. And I told her, yes, please go play. I want you to play, but also you know yourself the most, not me. So I want you to challenge yourself, but go at a 50, 60, 70%. Build that intensity up so that you know what's going on for you, so that you're not going in just like, okay, I am scared shitless and I don't know what's going to happen when I take my next serve, or if I dive off the blocks, what's going to happen. So it's important that you have that confidence to go in. And it's not just a physical therapist that does it. That's going to help you. That's an all-around thing. Get good sleep, making sure you're having good diet, make sure you're hydrated. These are all things that's going to improve your performance and get you in the right track. And to be honest, as a physical therapist, I'm realizing how athletes don't really know and aren't educated enough on how sleep affects their performance, how eating right affects their performance, especially my younger athletes who are 16, 17 years old that are eating, Chick-fil-A every week and thinking that they're going to be successful when they get back on the, in the pool or in the hockey rink. Next, let's see. Any other questions? Any swimming related questions? Perfect. Good. I think that's all the questions on the live chat. So let's go to some of those Reddit questions that I had beforehand. Boom, boom. Ta-da. So, first question is, right neck, scapula, arm weak, and painful after swimming. Sometimes I have trouble sleeping because of that. Going to the gym seems to help, but doing lengths after lengths of freestyle or butterfly worsens the symptoms. My pull is not as efficient on this side compared to the left side. Any advice? He's a 27-year-old male who's a competitive swimming background. Sleep is essential. Sounds like he's having trouble sleeping. That's why a person usually is not recovering as quickly. Sleep is where our brain and body reset. That's why it's important for us to have good sleep, like I was talking about earlier, and sleeping in the right position. So in this person's case, when they're complaining about right neck and scapular pain, I would advise to sleep on your back as compared to sleeping on your prone, which is on your stomach. When you're on your stomach, you're putting a lot of pressure and pinching on the anterior side and medial side of that knee or that shoulder. So that's very painful and causes impingement. Lying on that side, same thing. You're putting, gravity is collapsing on yourself, so you're putting more pressure on that shoulder and that scapula. So go to the gym for strengthening exercises, scapular strengthening, body weight, or resistance between resistance bands or dumbbells. Mobility. Talking about butterfly, why does butterfly hurt more than freestyle or backstroke or breaststroke? It's because when we go into that long stroke that's causing you to do coming forward, you're causing that impingement, that bicep tendon is rolling underneath the shoulder in some cases, in severe cases, that causes that issue. So shoulder, bicep impingement, bicep strain is a common issue, especially when you're doing butterfly. Freestyle, same thing. When we're coming in this direction, you're punching down, you're pinching. That's why we're talking about those drills are important to find where your hand is in space and have that high elbow recovery to pull all the way through with freestyle, butterfly, breaststroke. That's how you get your bang for your buck. And then again, RTC stands for rotator cuff. So rotator cuff mobility and strengthening as well. Let's go to the next one. All right. Swim with fins and back pain. I've started swimming with fins more regularly, and I've noticed some lower back pain after a session. I'm easing into it since I haven't used them in years, but want to make sure I am not inadvertently setting myself up for injury. I'm an older swimmer, 48, and chasing a top 10 US Masters swimming time for 50 free in my age group. Has anyone experienced this? Do I just need to build strength, or should I step back from the fins? My advice is fins always help, especially if you're a sprinter trying to develop that speed, but it also puts a lot of strain on your lumbar spine if you are just getting back into kicking. So let's look at this. So imagine my butt's up here, and these are my legs kick and flutter and kick. So if I add fins, I'm increasing that moment on. So I'm engaging my glutes a lot more to pull and create that power. So of course your low back is going to be injured from that. So what we're need to do is increase your mobility and flexibility at your hips and your low back, and start doing some Superman holds or low level planks to help build your lumbar spine and your core so you're able to tolerate without increased pains. And again, this is just a thing. Fins should be used as an aid and not as a form of exercise. It's an aid for swimming. All right, let's go to the third question. So this is a new swimmer who has trapezius pain, which is your upper traps, I'm assuming, from what this person is talking about. I learned to swim at a young age, know a few strokes such as freestyle and backstroke, never swam any significant distances. Recently, I've been swimming in the ocean, calm bay water. I swim a few lengths and then tread water or backstroke for a break. I swam yesterday and last night suffered considerable trapezius discomfort. I was surprised that it was my traps and not that were in pain and not my shoulders, lats, or some other upper body muscle. Research has led me to understand that this is entirely normal for new swimmers and that I should reduce the interval between my sessions moving forward. Why the traps, though? So, my initial thought is there's a difference between swimming in a pool and swimming in the open water, and it's breathing, sighting, looking to see where you're going. When we're breathing in a pool, you got that black line in the bottom of the pool that you're staring that keeps you making sure you're going in a straight line. But when you're in open water, you have to look where you're going. So when you're picking up your head and looking around to see and sight to where you're going, you have to use your traps, especially if you're training and you're swimming at the same time. You're using and engaging those upper traps. So that's why I believe your traps are bothering you more than your shoulders, lats, and other upper body muscles. It changes your rhythm, it changes your stroke, and it changes the biomechanics of your stroke. So I recommend train sighting in a pool and then go out to the open water, or like you said, increase the intervals or intensity at which you're swimming so that you're not as sore to becoming in the future. Upper trap strengthening and cervical mobility stretches all can be provided at DNA Physical Therapy YouTube channel. All right, I believe this is the last question. Shoulder pain. So this person posted this picture for their injury on Reddit, so it's not mine. It says, where it is yellow on the diagram, this is where my shoulder hurts. So I was wondering if over swimming causes this pain or not stretching enough before and after. I swim for fun in the sea and also the pool, doing a few laps for like 15 minutes, maybe less. So I wonder if any of you guys have had this and how to get rid of this pain. I should add as an example, when I stretch, such as my arms are horizontal and I pull them behind me, I feel like this kind of ache or tension. Any tips? So the yellow shade is the biceps tendon and a supraspinatus referral pain. That is something that is common with swimmers. It caused from that bicep tendon that we were talking about earlier, where it could be strained or impinged doing butterfly or freestyle, poor breakdown in body mechanics or stroke mechanics when you're swimming. Common causes could be tight pecs, as we were talking about earlier, and weakness in the shoulder blade in the serratus anterior and the rhomboids. So common fix would be good wall angels, elbow push-ups, chin tucks, the fun jazz. All right, let's go back to the chat and see what we got. I hope everyone gains the confidence they need to get back to their sport. I hope they get their easy strength access and training. Feel free to reach out to me on virtual services. Again, DNA Physical Therapy, we offer a free 15-minute consult for anything that you need. So please feel free to reach out. Here's a question. For those of us that might not be swimmers, how can adding swimming be help build strength as I'm coming back to 100% after an injury? Swimming is a great rehab technique. I recommend swimming for everyone. I may be biased because I love it, but swimming is great. It's good for lower extremity injuries. So if you're recovering from a knee injury, meniscus tear, ACL tear, knee replacement, ankle injury, hip injury, just going to a pool, shallow pool, and walking in it. It relieves some of the pressure off of those limbs so that you feel more comfortable, more confident, and feel an ease into walking compared to on land. And if you fall, you're in a pool, so you just use your hands to pull you back up. Swimming is great for if you're having lung issues. I have a history of lung issues between blood clots and hypertension. That swimming is great to clear those lungs, build the endurance back up again, build your cardio endurance, your vascular endurance, your pulmonary endurance. All those things are great from swimming. I can't tell you enough. I currently have a client that is recovering from a severe knee injury and infection that took him out of work for 8 months. And we are just graduating from pool therapy and getting him back into land therapy, and he's improving on all that jazz. So DNA physical therapy will get you back to where you need. So enough with that. Last slide. Don't forget to reserve an appointment at dnaphysicaltherapy.com. And we got some special offers. Oh, we got a question. Last minute question. I'm a side sleeper and I've had some pain in my left shoulder lately. For those of us who aren't swimmers and don't have copious amount of upper body strength, what would you recommend? Well, I recommend sleeping on your back. No. I would recommend, it depends on if you're a side sleeper that sleeps like this, or if you sleep with your elbow up in that position. If numbness or tingling is something that you experience from sleeping on your side, I recommend bringing that arm down and in front of you. Let's change the angle of the camera here so I can give you a better look. So if you're a side sleeper, instead of sleeping with your head up here like this or on your side like that, you're putting a lot of pressure on the nerves and tendons that are coming from your neck down through your arm. So sleeping with your arm on your side and slightly in front of you, that's going to put less pressure on the inside of where all those arteries and nerves are coming out of, and less pinching of the arteries and nerves that are coming out of your neck here. So sleeping with your arm slightly in front of you would be a little bit more beneficial. Or there's a new thing called the cube pillow for side sleepers that I've heard good things from clients that have purchased that as well. Okay, let's see. Any more questions? Please keep them coming. I love it. Thank you, Sienna. Thank you, Dylan. Thank you, Miriam. And thank you, Miss Hall, for all those great questions. But anyway, let's go back to these great special offers that DNA Physical Therapy has for you. So, initial assessment, you have free one-on-one 15-minute virtual sessions. You can find those virtual sessions on our website at dnaphysicaltherapy.com under the services tab. And if you leave a review, you get 10% off your first session. Package deals, you get 5% off if you buy 4-pack, 4 visits, 10%, 16 visits, 15%. So we have great packages for you to do for all your newcomers out there. And if you don't have the time for physical therapy, I have purchased a shoulder rehab toolkit for you. That it's a 5-week program. That's 9 exercises that you perform 3 times a week for 5 weeks, and should be getting you back to your normal, healthy self. And then again, if you refer a friend and they reserve an appointment, you receive a free visit. Don't forget to like and subscribe to this channel and all the social media posts right here at the bottom. Okay, well, that's it for now. I'm going to take one more look at this, and no more questions. Perfect. Well, in that case, thank you guys for joining. Let me show you my face, I guess. And thank you for joining. I appreciate the time. Thank you for your patience at the beginning. I hope this looked as professional as it is, and that you are having a great day and you have a great weekend. And we'll be setting up another live stream in October, so please feel free to come and join us again. Oh, we have one more question. Please, Mr. Grantham, please. We'll keep it going. And Sienna, keep them coming. I'm all about the questions. I'm here for you. But yes, please feel free to take a look at our website, DNA Physical Therapy. In this channel, we post every week with new exercises, new easy tip toolkits for you. So this is great for you to join and get your needs. Virtual sessions are great to help you, especially if you can't squeeze you in your busy schedule. Then we can do virtual sessions as well. All right. You have a stress fracture in your back of the knee. What exercises should I recommend? Well, in the back of the knee? Okay. Well, stress fractures are more of a overuse issue. Or feel free, Sienna, to shoot me an email at I'm an avid walker. Okay. Um, hot girl walker. Let's get it. Um, so it depends on I would recommend your shoes. Make sure you have good shoes and make sure that you're replacing them frequently, especially if you're a hot girl walker. Make sure that it is constantly being maintained. If those shoes are working and you love them, make sure you have the correct orthotics that you have in them. They're very important to have good orthotics. Next, I would do calcium supplements to help improve your bone density, so decrease the risk of stress fractures coming on. And also, I would refrain from doing any high impact sports like jumping or running right now until that stress fracture in the back of your knee is healed. Especially if it's on the tibia, if it's on the posterior tibia, that is also. What orthotics do I recommend? I was talking about this with one of my clients today. Superfeet is my favorite one to go to because they have a different variety of lines between high profile, low profile, high stability, low stability, high impact, low impact. For you, I would get the low impact, and depending on your foot, if a clinician's ever told you have a high arch or low arch, use that recommendation. And then a lot of the running stores nowadays have good, foot analyzers, and they can give you some custom orthotics as well. If you're in California, I know Roadrunner does it. And then I know Dr. Scholl's has his own little thing, but I would stay away from those without consulting with a clinician or schedule an appointment with me. All right, Sienna? All right. Let's see here. I have a low back injury. I believe it was from doing yoga. The doctor believes it's a pinched nerve. What kind of physical therapy could I do? So, pinched nerve is a very vague terminology for they don't know what to do. I like to have my hands on therapy for me to do that, especially if it's a pinched nerve. If it's a pinched nerve and it's staying in one spot, that's great. If it's radiating down, then we definitely need to do some good exercises. I have a good, easy nerve floss video on my YouTube channel. Let's see if I can pull it up and throw it in the messages here. That is a sciatic nerve floss. I don't know if it's the sciatic nerve, but it feels good not just for the sciatic nerve, but also low back pain or pinched nerve. If you have a pinched nerve in your low back, this will definitely feel good for you. But if it is kind of thoracic spine, mid back, or higher, then this might not be the stretch for you. But here, I just posted it in the forum for you, the sciatic nerve stretch, which again is all on the YouTube channel for free. So feel free to like and subscribe to all this jazz. And I would love to work with you in the future. Any more questions? All right. Well, thank you again. This has been a blast. I loved it. I had a good time. Please, please, please like and subscribe and look out for our next scheduled event. All right. We're going to try to be doing this once a month. And if we don't have any questions from you guys as an audience, we're going to be pulling some questions from Reddit on the swimming forum or from the physical therapy forum on Reddit as well. All right. Don't forget to book an appointment at dnaphysicaltherapy.com and like and subscribe. Ayo.